Today I'm going to explain a very common question which my patients ask me very frequently. My patients frequently ask that, doctor, I want some change on my nose, but I like my profile. I don't want to change it, but I don't like my tip. In some cases, even there is no so flat nose, mostly for patients who had excess skin on the tip, we have to raise the bridge for proportion, for maybe for the same side profile, we need to raise the bridge. So this is about that. At surgery, what we are doing for changing the tip? Actually, there is no way to cut the tip and stitch them together, tip skin, to make it smaller. So what we are doing at the surgery, we make cartilage, tip cartilage and columellar cartilage stronger with some stitches and with some grafting techniques, and we stitch them together to make these length smaller. It gives slimmer nose illusion, slimmer nose tip illusion. And also, in some cases, alarplasty, which means the reduction of the nostrils, accompany this. But while we are doing this, because there is excessive skin, it also raises the tip like this. So profile changed. Actually, it seems like we do something on the bridge, but we didn't do. We just take the excess skin on the tip and bring them together to a new level. Of course, this is a little bit high. So what we are going to do, we raise the bridge to balance new tip position. And also, while we are doing some alarplasty, it's going to bring it down. What we are going to do, we make rasping to this bump and raise the bridge homogeneously in a good level to give a good proportion, which you are going to see now, to balance the tip. As you can see, while we balance the tip with higher bridge, actually it's a similar side profile, but it looks better with the new tip, and also with nostril reduction also helps the head of the tip comes a little bit down, and we have also other techniques to make it more down. And when we compare before and after, you can see that the side profile doesn't change so much. Actually, tip height looks like similar. But when we look from this view, you can see this raising of the bridge, augmentation of the bridge. It changes the front view a lot because it makes it look like narrower bridge now, and it's now in a more proportion between a new smaller tip. Of course, I also made osteotomies to make bones narrower. And what about the face? What about the front view? We take some excess skin from here, and to make them more straight, we make some alarplasty. Tip is smaller with stitches and grafting, and also you see maybe it's looking like subtle, but it gives a very good looking nose, very good proportion with we have to think with remaining part of the face. It's very important. As you see, if you try to do more small nose than this, it's going to look wide. So everything must be in balance. That's why even you like your profile view, sometimes we need to raise it. As you can see, this is the black part is the nose that before the augmentation, and there is imbalance between tip and the bridge. So after augmentation, this is our new nose, we have better profile, better balance. And this is the amount of raising we need for this patient. Also, with nostril reduction and some nose lengthening techniques, our new nose is a little bit come down, which makes more natural looking nose. And these millimeter changes at the nose gives us more natural look. So that's why in most cases we need to touch, even with small amount, all part of the nose for a natural and beautiful results.